Enlarge your penis safely and naturally, or better not? This is UroChannel, and today I'm going to explore and explain the problems and current strategies for penile enlargement. Watch the whole video to find out what my recommendations are. Hello and welcome to this special video from UroChannel about penile enlargement. My name is Stefan Buntrock. I'm a urologist and certified sexologist. As such, I'm familiar with both the technical and psychological aspects of the wish many men share, a larger penis. Women want bigger breasts, men want bigger penises, and I want a bigger audience. Therefore, I would appreciate your subscription to my channel to make it larger. Let's start at anatomy. Augmenting a female breast is quite easy compared to augmenting a penis. Look at it like this. The penis is an organ with function. Reproduction, pleasure, urination, and for many men, male status connected to its size and its ability to erect are directly linked to it. On this picture, you see the corpora cavernosa of the penis, which elongate during erection and are responsible for rigidity when erect. The urethra runs through the corpus spongiosum, which also elongates, but which is of subordinate importance for penile stability. In the outer layer, Buck's fascia is wrapped around the corpora that extends into the ligamentum suspensorium, which is attached to the pubic bone. Making a penis larger literally means that you will have to do something to the corpora, the urethra, the nerves, and the blood supply. You will have to elongate this somehow. For girth, okay, that's easier, you just do some bulking under the skin. But for length, I'm afraid to tell you, genuine elongation is impossible for the time being, because we don't have techniques to make organs bigger. The actual urological guidelines neither support penile elongation techniques nor injections for girth enhancement for cosmetic reasons. The efficacy of such procedures is not backed up by sufficient evidence. And safety is a big concern, meaning that penile enlargement is regarded purely experimental. There are two options that can increase penile length. Option number one is non-surgical and involves the use of stretching devices. The concept of stretching tissue is very old and has been used for thousands of years in indigenous populations all over the world. Just take a look at the urban jungle today and its inhabitants. Obviously, it's very easy to stretch your earlobes to ridiculous sizes. Could the same principle apply to stretching devices for the penis? Most probably. I prescribe them in Peyronie's disease to prevent the organ from the inevitable shrinking that is happening with the disease. Even for stretching devices, there is no reliable evidence. However, it appears that it might result in durable increases in length, but in very moderate amounts, like 0.4 to 0.7 inches. If you're looking for penile enlargement, most probably you are not looking for the subtle change, but for the real change. Stretching devices will not be able to deliver these results. Another strategy has to do with body weight. If you're overweight, your penis is going to appear smaller because the subcutaneous fat is increasingly going to cover parts of the penile shaft. So losing weight could be a strategy to reveal the so-called buried penis. And there is surgery as the one option left. When it comes to lengthening, as I said in the beginning, there is no true lengthening. So what surgeons do is to work around the problem. There is a ligament that connects the penis with the pubic bone. I showed it to you in the beginning of the video. This ligament is for stabilization during sexual activity. If you cut the structure, the penis will be mobilized and protrude more outside the body, thus appearing longer without being so. A kind of fake enlargement is the result without compromising the anatomy. However, this comes at a price, because erections are no longer stable and the erect penis will hang down. As a result, intercourse might become difficult because of the lack of stability. When it comes to girth, fat can be taken from the belly and transferred to the penile shaft. A significant amount of this fat will be absorbed by the body, so after a certain time, girth will become somewhat smaller, so one has to account for that during surgery. Silicone implant procedures are also done where medical silicone is used to enhance girth. There are also techniques on the market where hyaluronic acid is injected into the fascia. And there are grafting techniques. The tunica albuginea which is the layer that surrounds the corpora cavernosa, is incised and patches of specific graft material are placed, resulting in enhanced penile girth. What do I think as a professional? If it ain't broke, don't fix it. This is a good rule to live by. Most men who wish to enlarge their penis actually are normal in size. Any surgical procedure is linked to a number of unnecessary risks. In summary, healthy, normal-sized men risk a disfigurement of the penis if anything goes wrong. This includes gross deformity of the organ, asymmetries, shrinking of the penis, nasty infections that will damage the penis forever, loss of penile function, loss of penile sensitivity, and many more. In the worst case, you can lose your penis or parts of your penis, its function, and it will look so ugly that you don't want to show it to anyone anymore. What about penile enhancement pills? These are totally useless. As a sexologist, my quick tip is this: save your money and buy some flowers for the woman of your dreams. The effect will be unbelievable compared to penile enhancement pills. And while you have some money left because these pills cost a fortune, don't dress like a smurf and work on your manners. That'll impress most women much more than the world's largest penis. There is one exception. If you want to become a porn star, I guess penile size does matter. With this being said, thanks for watching. Bye bye.